AskReddit by prevalent tip 4118. What is the oddest thing you thought was normal and ended up being a medical problem? I thought I pulled a muscle playing with my dogs one day. 1 week later I finally go to the hospital because the pain is getting worse. Turns out I suffer from a genetic blood clotting condition and had a 2-foot log clot in my leg and multiple pulmonary embolisms on my lungs. Doctor was legit surprised I was alive. Factor V Leiden? It took my lungs collapsing at 17 years old before doctors realized I wasn't breathing in deeply enough to expand the bottom half of my lungs for basically my whole life. They asked why I never complained about shortness of breath. I never knew breathing was supposed to be easier than what I was experiencing. Everyone just took a deep breath, lol. Until I was 16 I thought everyone got stomach cramps a few times a day. Turns out I'm lactose intolerant. My 5th grade math teacher thought I hated her because I always got stomach cramps and asked to go to nurse. No, it was just the period after lunch, where milk was the only option to drink, and it turned out I had developed a lactose intolerance. I even went to the doctor about it and he told my mom I was making it up. It was the school secretary who figured it out. My family told me I would randomly space out, although I never remembered, or thought it was normal. Turned out, I was having absence seizures. We only found that out at a routine doctor's appointment, just conversing with the doc, when I guess I just came to when the doctor said she wanted to get a bunch of tests done. Been an epileptic for almost 17 years now. Edit. I woke up to all these upvotes and replies and was shocked, tbh, to see how many of my Reddit fam has or had what I have. Unfortunately, my epilepsy has evolved into tonic-clonic seizures. I rarely have absences anymore, but had one focal back in November. For anyone who has friends and or family who has seizures and epilepsy, thank you for being there for them. Just know, we appreciate you all. For all that have seizures and epilepsy, unite. Love you all Reddit fam, you're the best. Weird confusing epilepsy club. I made my entire family think I was having a stroke by having my first focal seizure, while awake, go into status epilepticus. My symptoms almost perfectly match it since half my body goes numb and hard to control along with slurred speech and lowered cognitive function until the seizure is over. The doctors had no idea what to do with me and I got to take a vacation in the hospital with a deer house style investigation going on. That pulled muscle was actually a collapsed lung. After days of hot baths, massages, trying to relax nothing helped. No wonder. I had a spontaneous collapsed lung. It felt like there was a balloon in my chest inflating, because the air I was breathing would leak out and get trapped in my chest cavity. I'd have these really minor facial twitches, like a single small muscle in my upper lip or eyebrow. Nothing even severe enough to be visible by others. However, they'd last for a few weeks straight, even while I was trying to sleep. I didn't think twice about it. They always went away on their own, after all. After I suddenly went blind in my left eye and got diagnosed with multiple sclerosis, I connected the dots. Edit. Facial twitches are normal. Just because you have twitches often doesn't mean you have a problem, especially if you don't have any other reason to believe you have multiple sclerosis or any other disease. My twitches were constant for weeks. And even then, there are other, less serious, and probably more likely, things that can cause that. Please don't let my comments stress you out. And I've just realized those twitches are probably connected to my having as I got diagnosed after ordinarily going blind in one eye as well. Get the fuck out of this thread if you have health anxiety, lol. You're right lol. A random sharp pain above my right ear and my tongue curling slightly. I thought it was just old age. Doc recognized it instantly as something wrong with my tongue. The cancer has been cured for 7 years. What an unusual symptom. Upvoting for visibility, this could help someone else. Glad you're doing well. Bent over to pick something up and felt a twinge in my groin. I'm male. I thought perhaps it may be a hernia. I wasn't too concerned about it, then things started to ache a bit. I went to the doctor only to find out I had testicular cancer. Fortunately, after we cut out lefty and got all the results back from pathology, it was staged at 1A seminoma. Meaning the surgery alone was all the treatment I needed. Lost a soldier, won the war. Lol. I thought I was constipated for a few days. Hurt like hell. Turned out to be diverticulitis and a perforated colon. My wife called the ER and they brought me in without tridge and sent a chaplain. I lost a foot of my large intestines and almost died. I read you lost a foot and was like OMG. Then kept reading of, and was like, oh you, not an actual foot. Then kept onto my large intestines and almost died. Not me, but one of my brother's friends in high school. This friend was a goober, always making silly but friendly jokes that make families laugh as a whole. All in all, a genuinely funny person. One day he took my sister's glasses and was acting like her, only to pause for a moment and then say, wait, is this how things are supposed to look? My man needed glasses and found out from fucking around. I'm glad the universe leaned towards him in a positive way as far as that went. Had this happen recently on a much less severe scale. Approaching my mid-30s and have never had glasses. I did see an eye doctor a handful of times throughout my 20s just to check in, but my vision was always fine. One day a few months back, one of my co-workers insisted I try his glasses on. I don't know why I obliged, but I'm glad I did because my vision has gotten so much worse and I didn't realize it until that moment. It was so gradual that I didn't notice. Not sleeping or eating for days but still feeling great and having more energy than your average athlete. Turns out you're bipolar. I'm a psych nurse and I want to tack onto this comment that working in this field has changed my view on bipolar disorder dramatically. Mania is truly unlike anything else. I do pretty good with the patients and I can usually get them calmed down with my words and tone of voice. Even patients who are actively psychotic can be reasoned with a lot of times. But with mania patients, I can't move the dial. There is no reasoning with them. It's literally like the reasoning center has just been closed for the season and they are just acting on random impulses. Of course, I'm just talking about the patients I see inpatient, so they are the more unmanageable cases. But I definitely have more sympathy for people who have done crazy things during a manic episode. I'm convinced they genuinely had no control over it. Removed. I was working at my computer one day and a white fog came over my right eye over the course of a few minutes. I went to my eye doctor, and he said it was just some floaters that he could see, and it would clear up in a few weeks. I waited for 3 weeks with no improvement. The eye doctor sent me to a retina specialist who couldn't find any issues. He referred me to a neuroophthalmologist. He sent me for a CT scan. And it turned out I had a 3 cm tumor on my pituitary that was pressing on the chiasm, crossing point of the optic nerves. After surgery, up my nose with a titanium hose, I could see again. However, I'm left with a permanent kidney dysfunction that is managed with medication. Used to drop my makeup all the time when I was getting ready in the morning. Ugh, so clumsy. Ended up being myoclonic seizures. Same. Used to drop everything in the morning. Then the grand mal seizures started after years of that happening. Who knew? I thought I had bad period cramps, then I thought I had acute food poisoning. Turns out I had ovarian torsion and my ovary was slowly dying over the course of a few days. Oof, I'm sorry. My son had testicular torsion about 2 years ago and he lost one. We're a nut house now. No more D's nuts. Had what I thought was a pimple on my armpit that I ignored. Wasn't overly concerned, thought it was something that would just go away. A few weeks later, I came down with what I thought was some sort of flu. The flu lasted longer than normal, so I decided to go to the emergency room to get checked out. Turned out that I had a large tumor in my chest caused by lymphoma, and the pimple on my armpit was actually a swollen lymph node. Apparently your belly button isn't supposed to hurt. It was an umbilical hernia. Wait. Like, did it hurt at all times or just with pressure? Because mine hurts when I put pressure on any part of my stomach. Behaves like those squishy toys with like spiders that pop those holes, and looks different that it once did. But I did have a laparoscopic appendectomy. I think I might need to look into that. I mean, now that I think about it. Yeah. Thank you, random redditor. You know how you get all congested after exercising, and wheeze for a bit before everything settles down again? No? Yeah, that's because most people don't have exercise-induced asthma. I was in my 30s before I knew that was a problem and not normal. My dad had the gall to tell me that I was out of shape and that was causing it when I was a 5 feet 9 inches, 125-pound teenage girl who played lacrosse. No dad, I was just having asthma attacks. Deleted. Had a slightly sprained ankle that just blew up in a day and split the skin. Turns out, not a sprain but pyoderma gangrenosum, a rare skin inflammation condition that acts like gangrene. Nobody could tell me what it was that made my ankle flesh explode. Within a week they were talking to me about amputation. Then Nurse Molly came back from vacation and identified it as she'd seen it once before. Still have both my feet and nearly full mobility. Grateful for teaching hospitals that draw professionals from all over like Nurse Molly. Depression. Apparently losing all hope and being numb to joy isn't just a part of growing up. I finally built up the courage to tell an adult I wanted to unsubscribe from life when I was a teen, and they responded with, "Oh, everyone feels that way at some point," and then the conversation ended LMAO. Sharp, excruciating pain in my hand. Thought it was arthritis, it runs in the family. Nope. Bone tumor, thankfully non-malignant, slowly eating its way through my hand. 2 surgeries, one to remove the tumor, one to get bone graft from my femur, done at once, some cadaver bone, lots of excruciating physical therapy and an early scar later, no more pain. TMI, but when I originally started getting my period and using tampons, I would use it and still bleed. I couldn't understand why they were so simple and somehow were not working. I switched to pads. Years later I found out it was because I had a membrane down my vaginal canal that split it in two. The tampon was only going up one side and I was still bleeding from the other. Wild. Suddenly getting dizzy, heart racing, hearing fading out, eventually throwing up and passing out if I go too long without food. Didn't learn till my mid-20s that not everyone had piles of snacks everywhere they went so they didn't end up on the floor. I've been tested for diabetes 5 times and it's not that, so who knows. Just can't get too hungry or I'm fucked, I guess. Do salty snacks help? Cause what you described was my life before my POTS diagnosis. I kept telling my OB I was worried about my legs, ankles swelling in the later part of my pregnancy. They dismissed it, told me all pregnant people experience it. At 39 weeks I got sent to the hospital for extra monitoring on the baby due to an irregular test. She ended up being fine but my blood pressure was crazy high. I was induced that night and then given an emergency C-section due to severe preeclampsia. Not a fun start to my baby's life, but she's here and healthy so I can't be too upset. Just letting you know it's okay to be upset and thankful for a healthy baby at the same time. A lot of people, including medical professionals, can invalidate those feelings around a traumatic labor and delivery.